idea of looking at these dural connections. So dura, if you're not remembering or not familiar with it, is an investment. It's a lining of all the cranial structures, and it forms compartments that our brain sits in. So distortions in the dura are real. There's an area at the base of the skull many of you have heard of called the myodural bridge. If you haven't heard of it, look it up. Fascinating. I actually wrote down, I thought, a quote that was so interesting because I was floored that the American Journal of Neuroradiology came out and talked about this and made a statement. And they said, in mild TBI, the RCP minor, right, rectus captus posterior minor, which is a tiny little muscle that goes from C1, first cervical vertebra, with a direct connection to the dura. They found that it's a direct connection. It's the only suboccipital muscle whose cross-sectional area is associated with symptom severity and worse outcome. Given the unique connection of this muscle to dura, this finding may suggest that pathology of the MDB, myodural bridge, contributes to symptomology and prognosis in mild TBI. One of the things we see is something called post-concussion syndrome, where people just don't get better. So when you look at concussion, we automatically think that it's just injury to the brain, and oftentimes it's other things that feed in with lines of tension and strain patterns into the brain. Craniosacral therapy can help alleviate that because of the direct fascial connections to the brain through something called glial end feet. There's an interesting membrane system from the pia mater that they're finding now connects to the brain and goes deep into these brain structures.